Friday, everyone, and welcome to Physio Move and Groove. My name is Jeannie. I'm a physical therapist with over 25 years of experience helping people to be able to move well, feel well, and be well. So today we're going to be talking about something called plantar fasciitis. Many of you have probably heard of this problem, but don't know exactly what it is. So have you ever woke up in the morning, go to take that first step out of bed, and you get this stabbing pain in your heel? Or how about even if you've been sitting for a while, maybe at the movie theater or even at your desk, you go to stand up, you try to walk, and again, you get this stabbing pain starting at your heel, maybe going all along the arch of your foot. So chances are this very well could be something called plantar fasciitis. What the plantar fascia is it's like a very thick band, almost like ligamentous tissue that runs from the bottom of your heel and splays out across to your toes. And it can become very irritated. Usually it's with repetitive activities, but oftentimes it's due to the biomechanics of how we walk. So that's the first thing I want to talk about. Now, there are plenty of things that your physiotherapist or physical therapist, depending on what country you live in, is going to be able to help you with this problem. It's a pretty common problem, but sometimes it takes a while to get in to see them, and this is something that can help you along your journey to be able to walk with less pain. So first off, if any of you listening to this are wearing shoes like these, slides, flip-flops, pretty popular, this is the season for them right now, get rid of them. Those are probably the worst things that you can wear on your feet to begin with, but really bad if you have plantar fasciitis. Oftentimes, plantar fasciitis is caused by the way that we walk, especially for people that have pretty flat feet and tend to walk well over on their foot as they're walking. That causes a lot of stress. About 95% of the people that experience plantar fasciitis will experience it to the attachment on the medial side of their calcaneus, of your heel. So that's where most of the problems occur, and that is because that's where most of that rotatory force is. So welcome your nice supportive gym shoe. This is something that you should be wearing for a lot of different problems that we have, but especially for plantar fasciitis. Another thing that can really help you is if you get an orthotic or a shoe insert that you can put inside your gym shoe. Doesn't have to be anything fancy or expensive. You can just get something over the counter or off of Amazon or wherever, but get it. The ones I like are something called Super Feet, usually for the pronated foot. And you will put it inside your shoe, and that will help to bring the ground up to your foot so that you're not going to spend so much time rolling your foot. So that's the first step, is adjusting what footwear you're wearing. Next thing, one of the things that can actually help you by about 50% to decrease your pain when you first get up in the morning is to just kind of sit there and bring your toes down and up. And do that for about 20 times. One of the problems when we sleep is our toes tend to point downwards. And what that does is it tightens that plantar fascia. Then we go to take our first step in the morning and we splay our foot on the ground. Well, that plantar fascia is already so tight that it just pulls on that medial side of that heel and creates even more inflammation. So by just pointing your feet up and down, you can get the blood flowing, you can loosen it up, and when you go to take that first step, it's not going to hurt quite as bad. So that's the second piece of advice. Third piece of advice that you can do is to somehow try to loosen up that tissue. So one of the most effective techniques that you might see or experience when you go to your physical therapist, they might use a special tool on you called instrument-assisted soft tissue mobilization. They might use hop grips, it might be Grasson technique, but basically what they're doing is trying to release that myofascial restriction within the plantar fascia. But you can do this at home. So what you'll simply do is take off your sock. You can use any kind of lotion that you want. Doesn't really matter. Coconut oil works really well. You'll just kind of spread that over your heel and your arch. And then you can use a butter knife. Works pretty well. Obviously not the serrated edge, or you'll be needing more than just physical therapy. You'll use this non-serrated part. You're just kind of dig in there, go from the medial side of that heel and go all the way across and back and forth. And you're just going to try to dig in there a little bit. You do have to push kind of hard. And you're just going to go back and forth several times. You can do it for about a minute or so as you're trying to release the tightness within that plantar fascia. So you'll go back and forth, just like that. Okay, and you can dig in there a little bit more on that medial side where most of the irritation occurs. And people, if you've heard of people say that you have a heel spur, typically the heel spur isn't even the problem. The problem is where the plantar fascia attaches to the medial side of that heel and continues to pull and pull and pull, and a heel spur evolves. So the last thing in the world that you want to do is get that heel spur removed, because oftentimes they just come back, and they come back because you haven't actually corrected the issue of why it's happening. So I'm going to say this now, do not have surgery to remove that heel spur, but I'll repeat it again just to remind you in case that is suggested to you. So now after you've released your tissue, the other thing that you want to do is actually stretch out the plantar fascia and your calf muscles, because your calf muscles, if they're tight, they're going to pull on that area of your heel too. I'm not going to spend too much time on stretching of the calf muscles because I have another video that talks all about the importance of stretching. But I will show you how to stretch your calf muscle. So basically, if I want to stretch out my left calf muscle, you're going to stand forward with your right leg, and you'll keep this left foot back. You want the toes to be straight ahead. You don't want your toes to be pointing outwards because you'll actually release the stretch on your calf muscle. So you'll have it so that your heel is down, front leg is bent, and you feel a stretch. This one is more for the upper calf, but we have more than one calf muscle. So in order to get the lower calf muscle, you have to bend your knee. So when you bend your knee, you'll feel it lower down in that calf muscle. So the first one, your leg is straight. The next one, your leg is bent. Sometimes it's easier to do against a wall, just to give you a little bit added support. Another thing that you might want to do on your edge of your step, we got a little step stool here, but you can just do it on your stairs, is step up and hang your left foot off, or whatever foot you're stretching, just put the ball of the foot there, and again, hang that foot off and stretch that out. So again, all these stretches should be held for 30 seconds. Do it 3 to 5 times on each foot. So we'll be stretching all of those things in and around the calf muscle. The last thing that is super important as well, anytime there's inflammation anywhere, is to apply ice. So you can apply an ice pack, you can use frozen vegetables if you like, or one of the best things you can do for your plantar fascia is to take a water bottle, freeze it, and then the benefit of this is that you can actually put it underneath your foot and you can roll it. So you'll get the advantage of the ice, which is a cooling factor all along that arch, but also you're going to be rolling it, so you're going to be releasing that plantar fascia too. Another thing you can do to release the plantar fascia if you don't want to do the little knife trick is you can get a tennis ball, or you can get a golf ball, or you can get a lacrosse ball, anything in there, and just roll out that arch to try to release it. It's also helpful if you've been sitting for a while. Golf ball's nice and small, pretty portable, plus it's golf season now, that you can just have that golf ball before you get up out of your chair, roll out your heel first, and then go ahead and get up. And you'll notice that it should move easier. So there you have it, folks, some ideas for you to consider. Shoe wear, orthotics, you're releasing either whether it be with that little butter knife or whether it be with a tennis ball, stretching, and then ice. And if you can do all of these things, that should really help to release some of the inflammation in this plantar fascia. Last thing is, if none of this stuff seems to work, you can often use a night splint or a boot at nighttime to help to keep your foot up into that dorsiflexed position with your toes up to the air, which just puts a stretch on that plantar fascia. So when you go to get up out of bed at first thing in the morning, the plantar fascia has not got tight. It's a bit uncomfortable. It's hard to sleep with, so I wouldn't start with that. But oftentimes, if you wear that for 2 weeks, it can help resolve the problem. So there are some ideas for you to try to help you to be able to get moving and grooving. And if you are new to this channel, I will release videos every Friday to help you to be able to move well, feel well, and be well. So thanks for tuning in, and I will catch you next Friday. And I'm going to dance my way out of here. Have a good weekend.